Is there for us. Good morning, Ogutu. What are the expectations from today's meeting?
Well, thank you so much, Maringa. We are here with the Executive Director, Network for Adolescents and Youth of Africa, Kenya. That is NAYA Kenya, Mr. Victor Rasugu, who is here with me. And as you mentioned, the meeting is on to take stock of the deliberations between the organization and the members of county assemblies drawn from the 3 counties who are right here. So welcome to KTN News, Mr. Rasugu. Briefly take us through, the declaration, what you came up with 5 years ago. What exactly were the county assembly members who are here in the meeting supposed to do when it comes to, improving reproductive health among the adolescents and youth?
Thank you very much. So there were 7 key action points for the members of the county assembly. One was to increasingly look at the facilities that offer the youth-friendly services in line with the National Adolescent Sexual and Reproductive Health Policy of 2015 and the National Adolescent and Youth Guidelines for Provision of Youth-Friendly Services 2016. There was also the action on increased budgetary allocation for youth-friendly services and other health services that are targeting young people. Then there was the action on the meaningful participation and involvement of young people in policy processes so that they can be able to give their voices. There was the action point on the data revolution so that we have a clear data a clear data bank where all this information can be found in the counties on what is working and what is not working, and how then data can be used for decision making, as well as also there was an action point on enabling environment in terms of the policy and legislative framework to support programming. And then there was finally there was an action point around public-private partnership that targets the health sector for improved service delivery of the health to young people and the other general population.
Okay, Rasugu, before I let you go, this is something that the MCAs and the organization are here deliberating, but of course from what you've enumerated just a while back, what's supposed to be the way forward, and why is this one being tied to the 2022 general election as much as we are taking the stock?
Well, we are not really tying it to the 2022 election, but what is happening is that we are looking at the stock. For example, we have seen very deliberate moves by different counties. Recently, under the Right Here, Right Now program, we signed a 5-year MOU with the Kisumu County, and then we have the Power to Youth program. We have signed MOUs with other counties, and we are rolling this. But the most important and critical thing is how do we ensure that we continuously improve the health of young people, to improve their health-seeking behaviors, and this will help in terms of reducing the disease burden and also the healthcare service provision burden at different service delivery points. But on election, we are moving into an election period, of course, and we want also the issues of young people to be at the center stage of discussion, because young people are the majority in this country, and therefore their health matter a lot. And that's the only way we can be able to revolutionize the economy and bring their voices to the fore.
Okay, thank you so much. If time will allow, as we have also a stakeholder here, just come over. Farida Salim, welcome to KTN News. So from where you sit, of course, you've been a member of County Assembly. And what do you make of all the deliberation that's going on?
My name is Farida Salim, former nominated MCA. And while serving in the County Assembly, I was the Vice Chair of Health Services Committee. And I remember NAYA was helping us a lot in terms of the budgeting processes. So at some point, I had a discussion with the Executive Director, Victor, and we discussed that apart from the budget, there are many other challenges that are facing the youth health-wise. And so we sat down, we brainstormed, and came up with a plan of action, which is now known as Homa Bay Accord. This is where the 7
Indeed, we apologize for that technical hitch. Now let's follow up on the illicit indeed. And let's follow up now on the illicit liquor menace that has made headlines the past 1 week. 8 people died in Njoro after consuming illicit liquor. In Hodi, 11 people died 3 months ago. The concern now is the growing number of illicit liquor dens that are now cropping up again.